Hello, Alex.
Hello.
I'm your nurse. I'm gonna go over some information that your doctor wants you to know before you're gonna go home. Okay, do you have any questions or concerns with insulin or anything?
I'm not sure exactly on how to use the sliding scale and with the amounts, how much amount of insulin to put with the blood level, with the glucose level.
Okay. The doctor's order says to check your blood sugar before meals and bedtime, so you want to make sure you do that. And looks like he does give you some insulin with the sliding scale. I will go over with you over your insulins and sliding scale, so when you're gonna go home you'll know which insulin to use with the sliding scale, okay?
Okay.
First, here's the sliding scale for you. This is the sliding scale a doctor wants you to use, and it's the sliding scale based on your health, your weight, and your diabetes type. So for each person, the sliding scale will be different. So you want to make sure you're going to stick with that sliding scale he gives you. Okay, and before you do it, check your check, or before you do insulin, you want to make sure you got everything you need. You'll need alcohol wipe to wipe the area you're going to inject. And the bottle of insulin. You need an insulin and syringe. Do you know what syringe to use for insulin?
The one with the orange caps.
That's right, and the one that says insulin on the bag, this is the syringes you want to use. You don't want to use any other syringes. Okay, make sure you got, what else? Okay, we got alcohol wipes, insulin, and blood sugar machine. Okay, and then the next thing we want to do before you check your insulin, make sure you wash your hands with soap and water and dry well. Okay? So we're gonna go and wash your hand. Okay, do you want to check your blood sugar right now?
Yes.
Okay, looks like your blood sugar is 95 right now. Okay, now look at your scale. Yeah, wipe your finger first. Okay, now look at your scale.
Yes.
See where's the numbers? It says if your blood sugar is 51 to 110, then you're gonna give how much units to yourself?
5 units.
5 units, and yours is 95. So you want to give yourself 5 units of insulin. Okay. Before you're gonna give yourself the insulin, get the insulin first. You want to take the bottle in your hands. You don't want to shake it, but you want to roll it with your palms and fingers a few times. You don't want to shake the insulin because it's going to create bubbles, which can get in the syringe. We don't want bubbles in the bottle. Okay. Then you want to take an alcohol wipe and wipe the rubber part of the bottle. Now, before you're gonna inject insulin to your syringe, you want to make sure you get air first. And air should be equal to the same amount you're gonna give insulin yourself. So, if you have to give yourself 5 units of insulin, how much air will you put in the syringe?
5 units.
That's
also.
right. Yep. Yep. Make sure you put air. Now, take it and put it in the bottle. Push the plunge. Okay, now tip it over and get 5 units of insulin. You can get a little more than 5 units. And do you see any bubbles in there?
Yes, we do.
Okay, now why don't you just tap the syringe, make sure there's no bubbles. You want to get rid of the bubbles because when you have bubbles in syringe, it will decrease the amount of insulin you're gonna give yourself, and it also can create a barrier when you give a barrier in your skin. Is there any bubbles there?
Nope, not anymore.
Once you get rid of the bubbles, make sure just push a little, just so you can get 5 units, exact 5 units. And you can push insulin only when you use single insulin, not when you mix insulins together.
Okay.
Okay, so you got 5 units? You want to show me so I can look? Do you have 5 units? Okay, you got 5 units and there's no bubbles. It's pretty good. Okay, now you can just put it on the table, make sure needle doesn't touch anything. Okay, now before that, I want you to, before you're gonna give yourself anything, I want you to practice on this little toy. Just pretend that it's a belly button. You want to make sure you give 2 inches away from the belly button.
Okay.
You don't want to give around the belly button because you have a lot of blood vessels going around it, and we don't want to hit any blood vessels. So you're gonna give 2 inches away from the belly button. Now, then you want to wipe the area in a circular motion. Once you wipe the area, before you inject, you want to hold the skin like this, and you go with your syringe 45 degrees.
Okay.
Okay. Now you want to go 45 degrees. That's too low. You're doing it right now. Yep. Okay. And do it quick. And push out. Okay. And this is how you do insulin. Now, since you already checked your blood sugar, I want you to inject right now. I want you to give yourself the insulin. Okay?
Okay.
Alright. Okay, yep, that's right. You're gonna wipe the rubber area. Make sure you put in air first. Okay. Yeah, just a little above 5. Make sure there's no bubbles. If there's bubbles, tap on it. Now push it in just so it's exactly 5 units. And you always want to double check, make sure you got right units.
Okay.
Alright. Okay. Put the syringe down. Now, do you know the areas where you're going to inject yourself?
The belly, the thighs, back of arms.
And I got your picture so you know what areas you can give yourself an insulin.
Okay.
And you want to avoid what area?
The belly button.
Okay. Alright, where are you going to give your insulin right now?
Right here on this side.
Okay. Why don't you wipe stomach? Quick, inject yourself. Take it out. And you don't recap your syringe, but you're gonna throw it away in a sharp container, okay?
Okay.
Alright. And this is how you do insulin. Do you have any questions?
No. I think that's it. Do I wipe?
Alright. That's it.
Okay.
And I'm your cameraman.